In New South Wales, approximately 15% of all calls to 000 or 100,000 people require mental health care. In 2016, 225,487 children were at risk of or experienced abuse and/or neglect in Australia. The students at Naruki Galgal are among the many vulnerable youth in Australia who experience marginalisation as a result of poor home life, hereditary health conditions and childhood adversities that are carried into adulthood through the development of mental illness. My community engagement experience gave me an insight to the reasons behind behavioural and learning difficulties in adolescence and how these affect transition into adulthood. In order to overcome these disadvantages, issues must be addressed by all avenues of healthcare, including paramedics. It is evident that paramedics are underqualified to address these complex psychosocial issues despite the significant number of people who access emergency ambulance services with them. The aim of this proposal is to introduce formal psychological and social work training for paramedics to address the mental health and social issues faced by vulnerable youth and their families. This would include psychological and social referral pathways, communication training for de-escalation, and rapport building and risk assessment for child safety with a reporting system. Vulnerable youth face a multitude of mental health and social issues that increase the likelihood of using emergency ambulance services. Adverse childhood experiences are traumatic events that may be direct maltreatment or environments that lead to poor development and health outcomes. They range from the following: emotional, physical, and sexual abuse or neglect, household substance abuse, mental illness, parental or familial separation, incarceration of family members, and violence with a focus on violence towards mothers. Poverty, community exclusion, and parents who experience ADEs as a child are some of the many factors that contribute to a child experiencing ADEs. ADEs have a significant impact on short and long-term physical and mental health as well as socialization. Children who experience maltreatment, such as abuse and neglect, suffer significant implications to the development of their psychopathology. These children are likely to have behavioural problems, dysfunctional relationships, poor schooling outcomes, and are at a higher risk of substance abuse and mental illness. As a result, these psychological and social difficulties, in conjunction with ACEs, are carried into adulthood, manifesting as mental health issues that increase the likelihood of accessing emergency ambulance services. The Young Minds Matter survey provides a snapshot of the mental health of Australian youth. 1 in 7 children aged 4 to 17 have a mental health issue, with the most common being major depressive disorders, anxiety disorders, attention deficit hyperactivity disorder, and conduct disorder. The prevalence of mental health issues increases with step, blended, and one-parent families, families with an income below $52,000 a year, parental unemployment, and overall poor family functioning. 1 in 20 individuals aged 16 to 17 years old has attempted suicide. 38% of 13 to 17-year-olds had consumed alcohol, and 10% had smoked marijuana once a week before, both increasing in use with the prevalence of mental illness. A study of the Scotland Ambulance Service shows the extent of the potential interaction paramedics have with patients who die by suicide and other mental health-related causes. Of the 6,802 patients attended to for mental health issues in 1 year, 4.1% died within a year of being attended to by paramedics. 35% of these deaths were as a result of suicide, and 23% were related to mental and behavioural disorders, including drug and alcohol addiction. The study shows that of the 772 people who died by suicide in 2011 in Scotland, 8% had been in contact with ambulance paramedics. Paramedics are among the few healthcare professionals that are humbly invited into the homes of members of the community, making it even more important that they are prepared for all illnesses. This also means they have the opportunity to see firsthand the living conditions and home life of patients. Scope of practice for paramedics is a hybrid of treatment methods for a range of medical issues due to the urgency and unpredictability of the incidents they are called to. Unfortunately, there is limited training in psychosocial areas of health for paramedics, with more focus on physical signs and symptoms of illness and pharmacological treatment methods. The transition from vocational to university degree qualification for paramedics increases younger age paramedics on road as many enter university directly after school. This may mean new paramedics have little life experience that may be useful in dealing with psychosocial incidents, especially while there is limited training. Furthermore, lack of exposure to the communities that are commonly involved in these incidents lead to judgment that affects treatment. A 2014 study displays the experience of graduate paramedics on road when confronted with members of low socioeconomic communities with other confronting lifestyles. Many state their experiences as upsetting and could not help but judge or blame their patients for the situations they were in. Another study supported by Beyond Blue displays a snippet of the attitudes and feelings of paramedics in regards to psychological training. Less than 14% of paramedics felt they had adequate training for mental health incidents. Only 9.2% stated they were properly trained in communication skills, and less than 10% felt they were adequately trained to perform a mental state examination. Mental health risk assessments and crisis intervention, which are the main assessment and treatment tools for mental health incidents. Other forms of treatment include mental health sectioning, whereby paramedics have permission to take patients to hospital without consent if they meet the criteria. However, sectioning is limited and does not encapsulate the wide presentations of psychological illnesses. Furthermore, paramedics are not trained adequately to recognize the signs and symptoms of the plethora of mental illnesses, and taking patients to emergency departments is not always the best solution. These processes do not take into account how social factors can affect mental health and how paramedics can assess these social issues. The Mental Health Acute Assessment Paramedic Team in Western Sydney shows progression in this field, but it is evident that all paramedics across the country must have extensive psychosocial training to meet patient needs. Paramedics are underqualified for the complex psychosocial issues their patients face. To address these issues, paramedics must be adequately trained to psychologically assess patients and learn how to communicate with these individuals. This includes de-escalation training for mental health crises such as self-harm and suicide. Currently, the suicide and mental health crisis interventions of ambulance services is limited in instruction for paramedics on road. University placements at mental health facilities or with mental health practitioners would be useful to practice mental state examination and risk assessments. Working with mental health practitioners will improve paramedic ability to assess for mental illnesses that may assist in sectioning more patients when needed. Applied Suicide Intervention Skills Training, or ASSIST, is a workshop available for both community members and healthcare professionals and is used worldwide in suicide prevention. The training outlines communication techniques for those immediately at risk of suicide or how to approach those thinking about suicide. There is limited data on the efficacy of suicide de-escalation techniques in the community, likely due to the sensitive and unpredictable nature of suicide attempts. However, ASSIST has shown some increase in referral of youth to mental health care services by trainees. The confidence of trainees in suicide prevention is also improved, an important factor in treating difficult patients. Similar to paramedics, social workers enter the homes of the community to assess the safety of children. There are many frameworks used to assess child safety and risk at home, with debate over the most effective and evidence-based. The context and aim of each risk assessment relates to which framework is most suited. For example, Assessing homes with children in out-of-home care, suspected of abuse, or in families of cultural diversity would each require different frameworks. The structured decision-making framework outlines tools and assessments that can be carried out to assess most children at risk and is currently used by the Department of Communities and Justice. Paramedics must adopt some of these frameworks to rapidly perform risk assessments and then relay them directly to the Department of Community and Justice via official documentation and police reporting. If paramedics are adequately trained in these areas, youth experiencing abuse or neglect would benefit greatly. Social worker visits may allow aspects of abuse to be missed if families are expecting to be visited by social services. Calls to 000 are often unplanned and emotionally provoking for patients and families. And if paramedics suspect injuries or incidents are a result of abuse, it may be harder for perpetrators to lie. It also gives paramedics the opportunity to speak directly with victims directly after potential incidents, a rare occasion for many social services. Communicating with patients for the first time is a daunting experience. For this reason, it is imperative university students are given the opportunity to interact with a wide range of individuals in the community before emergency placements to learn firsthand methods of communication and about their lifestyles. In turn, this will lead to less judgment on road when encountering members of the community they are not usually in contact with, as they have had some prior experience through university placements. These are communities that vulnerable youth often stem from and who paramedics have trouble building rapport with, including low socioeconomic communities, Aboriginal and Torres Strait Islanders, and families with a history of domestic violence, mental health issues, and substance abuse. There are many facilities and services that work with these communities that could be potential university placements. This change of training and intern practice would have a significant benefit for those suffering psychosocial issues. This would also be beneficial for paramedics as they would feel confident in their treatment and have experience in communicating with all patients. In order to impose this change of practice, university curriculums need to be altered and standardized across all universities. Currently, each university that offers paramedicine have their own unit schedule, with some focusing on certain areas and others omitting topics completely. There is also different requirements and opportunities for emergency ambulance placement hours. This is made possible through authorization by the Council of Ambulance Authorities, who set the standards for paramedic practice in universities. It must be brought to the attention of the CAA that paramedicine degrees are not only not equal across universities, but content does not meet the needs of the paramedic profession. Units thoroughly addressing psychological and social assessment in conjunction with relevant practical placements must be added to university degrees. Placements must be in settings that provide extensive exposure to vulnerable communities and patients requiring psychological assessment or treatment, as emergency placements with ambulance services are unpredictable in the type of incidents they prevent students to practice with. To move forward with this proposal, students, lecturers, and paramedics must advocate for these changes by bringing to light the research and experiences of mental health incidents on road to the CAA to change university curriculums. In New South Wales, approximately 15% of all calls to 000